My name is Grace Bottoni, and I'm a GP and also the Hepatitis C GP champion in Lewisham, which is in Southeast London. And my main role is to drive the Hepatitis C elimination programme in primary care. With my secondary care colleagues, I helped to deliver an educational session, and that was working in conjunction with our local education and training hub. And we delivered the educational session to our local GPs, nurses, and healthcare assistants. And our next stage is to work with individual GP practices, and that is to identify patients who could be at risk of hepatitis C and offer them a test. Before we even start to increase hepatitis C testing in primary care, we need to make sure that GPs know what to do with a positive result. So one of the first things that I worked on was developing a clear and effective referral pathway from primary care to secondary care where patients will be treated. So we worked with the South East London Operational Delivery Network based at King's College Hospital, and they now have a email address, a central email address where all the GP referrals can go to, and there is a specific referral form for GPs where we have explained how to interpret the results and who to test, and then that referral form is emailed directly to the secondary care teams and they will contact the patient. So this means that we have we know that GPs know what to do, patients know what to expect, and then they can start treatment as soon as possible. So I think there are two main groups that general practice should focus on. Firstly, it's people who might have injected drugs in the past but aren't currently injecting right now. And the second group is people who were born in countries of high prevalence of hepatitis C, but are now living in the UK. So both of these groups may have been exposed to hepatitis C when they were younger or many years ago, and they can be going undetected because they might not be developing symptoms for 20 to 30 years. There are obviously other groups that are at risk, and you can find more information on the Hep See You Later website. In primary care, in order to identify these groups, we need to be asking the right questions. And they can be awkward, but they are ultimately life-saving. And the Hep See You Later program is developing resources for patients that you can put in your GP surgeries, in your community settings. There is another group that is at risk of hepatitis C, but actually don't want to access their GP practice. And this could be for many reasons. Maybe they're embarrassed because they've known their GP for a long time, or simply they don't have time to come to the practice for a blood test. So the NHS has developed a self-testing portal that you can access online, and a hepatitis C test will be delivered straight to your door. So I've actually taken the test myself. It's really easy, and the package came to my door. It was very discreet, and I got my results within 2 days actually, and it says it can take up to 2 weeks, and it was really easy and really effective. So yeah, if you want to know more information about the self-testing portal, you can look on the Hep See You Later website. During my GP training, I spent 6 months in the HIV clinic and the sexual health clinics in Lewisham. And I particularly enjoyed the challenges really around HIV. And in particular, it was the misconceptions around HIV, and there's still a lot of stigma surrounding it, even though there is very effective treatment. And there are several misconceptions, not only in the general population, but also amongst healthcare professionals. And this spurred me on to become an HIV GP champion. And I have been doing this work for the last 4 years in Lewisham. And so, what particularly interested me about hepatitis C is that it is quite similar to HIV because there is still a lot of stigma surrounding it. And so, you know, this can be reduced with education and training. What's interesting is obviously with HIV, you can lead a very normal and healthy life. But with hepatitis C, you can actually go that extra step and you can cure it. So this is what sort of spurs me on to be this GP hepatitis C champion, because I really do believe that we can eliminate hepatitis C in England. I think one of the main challenges is that general practice is really overstretched. As a GP myself, I know the struggles that we're facing, and we are trying to manage patients with several comorbidities, and we have short appointment times, and we have a depleted workforce. So we really need to be careful not to overwhelm GPs with more requests. However, we are managing many conditions who are long-term, chronic, who don't have a cure. But with hepatitis C, there is a cure. So we really can eliminate this disease. And we have a easy test. We have now in Southeast London a straightforward pathway. And so patients can get treatment really quickly. So being able to be part of this national elimination program is really exciting. And, you know, we want to try and push hepatitis C to remain on the primary care agenda until we achieve elimination. And because we really want to make hepatitis C a disease of the past. So if you are interested in becoming a champion or want to know more, just contact someone from the Hep See You Later team, and we'll be in touch.